Hey everybody. So we had a video that I don't want to say went viral, but it got a good amount of views and a good amount of engagement. And it was me discussing trusting your physician and why I think that more of that needs to happen. Now, I got some feedback on that video, so I just kind of wanted to clear the air on a couple of things that I said because I don't want anything to be misconstrued, but I also want to keep this an open dialogue. So a lot of the feedback I got was negative that said that you're not God. Doctors aren't perfect. People make mistakes. And I totally agree with that. I couldn't agree more. Everybody makes mistakes, including physicians. That's not really the point of what I was getting to here. But what I want to talk about is the way that physicians go about practicing. And it's something that we call evidence-based medicine. Now, a lot of evidence-based medicine is probably exactly what you think. As new evidence comes out that shows different treatments are better and get better outcomes, then we adapt to those guidelines. But evidence-based medicine goes a little bit further than just with treatments. One thing that evidence-based medicine does is it looks at current guidelines and can we reduce doses of things? Can we crank the treatment back down a little bit so maybe we can reduce some adverse effects? And an example of this is new guidelines to treat pulmonary embolism just came out. And what a pulmonary embolism is a blood clot that goes to your lungs. I mean, it's a little more nuanced than that, but basically the guidelines said before you would use a drug that was Eliquis, it's a blood thinner, and you take a certain dose for so many doses, then you crank it back down, you go to 5 milligrams twice a day indefinitely. Now this works. It shows positive outcomes. However, some new studies came out that are showing that you can actually decrease that dose to 2.5 milligrams twice a day after 6 months in some populations. Now, what this means is that they looked at the data and they saw that you could get a similar effect with using less of this drug at this time. So this reduces, obviously, things like bleeds. Now, should we say that physicians are wrong because they've been recommending the 5 milligram twice a day indefinitely? I don't think so. The thing with evidence-based medicine is it's constantly adapting. So we're constantly running studies. We're looking at the data. We're seeing real time what's happening in people. And then new guidelines are being developed based upon the data that we gather. So where this physician says 5 milligrams twice a day indefinitely, now the recommendation says, hey, I can actually crank that down to 2.5 milligrams twice a day. What would you rather he or she do in that case? Do you want them to dig their heels in? Say, look, this is the guidelines when I learned it, I'm not changing, or would you like them to adapt the way that they practice? And this is the whole point. I don't want to get too in the details about treating pulmonary embolism. But my point here is that evidence-based medicine is constantly adapting. Now, these trials that are being run are publicly available. You can look at them. They are a bit overwhelming to read, especially if you don't have a background understanding statistics. It's a lot to take in. It's even a lot for me to take in. But if you have a physician that does practice evidence-based medicine, that does look into these guidelines and read these studies, this is exactly in their wheelhouse. And this is what I mean when I'm talking about trusting your physician, this kind of stuff. If your physician practices evidence-based medicine, which most of them do, and I'm not going to do a blanket statement and say all of them do, I understand the problem there. However, they're there to treat you. And my main question with all this is, if evidence-based medicine is not the way that you want somebody to take care of you, how do you want somebody to take care of you? Specifically, what do you want done? And I'm genuinely asking this question because I want to keep this, I've said it before, a conduit between medical professionals and everyday people. So I want to know, what do you want us to do differently other than practice evidence-based medicine? And if you don't really have an answer to that, then my statement back to you is, then trust evidence-based medicine. It's not always what you want to hear. There's a lot of people that say physicians are pushing drugs rather than treating the patient when it comes to lifestyle modifications. And I've yet to meet a physician in my whole life that hasn't put lifestyle modifications, diet and exercise above medications every single time. But the problem is lifestyle modifications aren't always possible for one reason or another, or they just don't happen. And in that case, medical intervention is necessary to receive the best possible outcomes. So my response to you is that they already preach diet, exercise, getting good sleep, but some people still don't want to do those things and then say, what else can we do? Well, the answer is medicine. And I've said this before, if alternative medicine worked, they would call it medicine. And I know I'm going to get some hate for that, but there are a ton of natural products that do have data out there and that I would recommend for certain things because that's evidence-based medicine. Alternative medicine, most of the time, is things that don't have any evidence behind them. So again, I want to keep this a conduit. You tell me, what can we do differently? How should we practice? And I would love to have an open dialogue about this because I don't see a better alternative than evidence-based medicine, which is the way we currently practice. And I hand it back off to you. I would love to hear your responses. I know I'm going to get some hate, and I look forward to the back and forth because I think this is the way that we mend the communities. This is the way that we create this trust. And please give me that feedback. Thank you.